begging at the insurance company, please accept my treatment plan, please. Sometimes I actually feel effective. I present my case, the insurance doctor agrees with my treatment plan, and I get a couple days before the next review. Other times, after I present what I think is a legitimate case for treatment, the insurance doctor says to me on the phone, case can't be seen, of course, doesn't meet criteria for admission or treatment, permission to treat denied, no reason given. But then I am told, if you don't agree with the denial, you can go appeal it. They know that I and most other doctors don't have the time to spend appealing all these denials. There's also no guarantee that the appeal will result in approval of treatment, so nothing to worry about at the insurance company. I am pleased to say that over the years, most of my patients have been geriatric and on traditional Medicare. Those cases have had their treatment services approved and paid with only occasional questioning of my treatment plans. Once I started treating so-called managed care Medicare cases, you know, the ones whose Medicare plans are controlled by the corporate insurance giants, that's when reductions of session lengths and inpatient stays and denial of treatment began. Another frustrating area of dealing with the commercial insurance world is which medication they will approve or authorize to be used. At the beginning of my career, I thought the prescribing doctor was the one who authorized which medication to use based on his or her years of experience. No, it's the insurance person who decides which medication is the cheapest to cover. When I say I'm concerned about ineffectiveness or problematic side effects if I use their choice, I'm told, "Doctor, you won't know if you don't try." Do you hear that? They want you and me as patients to experience the side effects and ineffectiveness rather than to accept my warning or your own doctor's warning of probable difficulties based on our years of experience. After all, the doctors and pharmacists on the payrolls of the insurance corporations know much better than I do what will be in the best interest of my patients. So, after hearing my examples, do you think we need to get big business out of our health care?
Yes!
They are in it for profit. And you know what? They say that I do what I do for profit. Ha! Profit? What profit? My fees are ignored by insurers, and I'm paid what the insurer decides I'll be paid. And lately, it's been zero. That's a major reason I closed my private practice office last year after 30 years of being in practice. In other words, no treatment provided, no treatment received is the end result of these corporate policies of fiscal efficiency. The insurance company people have told me on more than one occasion, "Doctor, you just need to balance your budget better." One more idea, and then I'll sit down for those who want me to be quick. I often wonder if the people who work for the corporate insurance companies at all levels would want themselves or their loved ones treated like the rest of us are. I've never heard an insurance worker tell me, "I know how you feel. I go through the same thing as you do for getting my health care needs covered and paid." I never hear that. I never hear that because they and the segment of our population that want no change in our healthcare delivery system, they think this way. Pardon me, I have to get in the snob mode. If I'm not affected by the problem, there is no problem. If I have enough money to pay high premiums and high deductibles, there's no problem. If there's, let's see, don't change my wonderful insurance plan just because there's a very large number of people who can't afford their insurance or don't seek medical care at all because they can't afford it. I don't even think of them as fellow citizens. I just don't think of them. All that's not a problem for me because I don't have the problem. Well, excuse me! Remember Steve Martin? It is your problem. It's everybody's problem. To the insurance company CEOs, administrators, and frontline people, or as I call them, the queens, the drones, and the worker bees, do you ever stop to think that the coverage you deny and the premiums and deductibles you demand may hurt your fellow citizens? Do you even care? Or is it just not your problem because you don't face these problems yourselves? Oh, wait.